Okay, so to start off, let's make sure that we're all on the same page when it comes to terminology. So what's the difference between targeting and prioritization? So targeting is based on the fact that different refugees have distinct needs and capacities, and that assistance should be provided according to refugees' actual needs instead of providing a blanket assistance. This should also lead to a more effective use of limited financial resources. Prioritization, on the other hand, is resource-driven, meaning that funding shortfalls put us in a position where we cannot meet all the needs that we have identified. And prioritization is done either through the reduction of the number of beneficiaries or the assistance value, or a combination of both. Next slide, please. So when do the community consultations take place within the broader targeting process? So this diagram is actually quite complex, but I'll just briefly introduce a few points. So if we look at the beginning, steps 1 and 2, registration and assessment, this is where we collect key data. Then step 3 is based on the data that we have collected and analyzed, we decide if targeting is even appropriate in a given context. If that is the case, we start the development of a targeting strategy, which also means that we develop draft eligibility criteria. So these draft eligibility criteria are developed through statistical analysis of assessment data or progress data, or both, and also through consultations with country and field office staff, including protection experts, to make sure that the criteria are also protection sensitive. Then afterwards, we do the consultations on these draft criteria and other aspects of the targeting or prioritization process. Then afterwards, steps 7 to 9, you see there's some other AAP related elements, such as information sharing with the wider communities, the establishment of an appeals mechanism to deal with any eligibility related complaints. And then we have other implementation steps and monitoring. Next slide, please. Community consultations support accountability to affected people. Communities will feel more respected if we involve them in the process, since their ideas, concerns and abilities are taken into account. This should also help to increase community ownership of and buy-in in the process. And the community feedback that we collect complements the quantitative data that we have already collected, so we have a more comprehensive data set. This should also help us to better adapt the targeting or prioritization approach to refugees' actual needs and the context. Finally, we should hopefully receive a reduced number of questions, complaints and appeals from refugees, since the eligibility criteria have been reviewed together with refugees and adapted based on their feedback. Also, as part of the broader targeting process and also as part of the consultations, we should share key messages with refugees and other key stakeholders, and this should help to make sure that everyone is well informed and understands why the changes are happening. Next slide, please. So what are some of the objectives of the consultations? Well, first of all, we want to capture communities' perceptions of their vulnerabilities. We also want to identify if they are facing any challenges due to any current shocks, so that this might be, for example, the ongoing COVID-19 pandemic. We also want to, of course, collect feedback on the proposed eligibility criteria from refugees to ensure that the most vulnerable groups are covered once we finalize these eligibility criteria. Again, the criteria should be further adapted and improved based on the feedback that we collect. Then we want to identify potential protection risks of the targeting or prioritization exercise and appropriate mitigation strategies together with refugees and host communities. We would also recommend to involve host communities in the consultation process. A bit more on that later on. Then the consultations are a great opportunity to assess refugees' capacities, skills and support needs in terms of livelihoods and self-reliance, which is important since because of the targeting or prioritization, some refugees will start to receive less assistance, or they will be entirely removed from the beneficiary list. So we really have to make sure that they have access to livelihoods and self-reliance opportunities. Then as a last point, again, we should share information throughout the process, also throughout the consultations on the targeting or prioritization. Here, I'd like to point out that the Joint Hub has developed consultation tools, focus group discussion and key informant interview guides, and you can find templates of those on the website, by the way. And those tools cover the different areas that I've just mentioned. So the tools have an informed consent section at the beginning that includes key messages. And then there are questions about refugees' vulnerabilities, the proposed eligibility criteria, any potential protection risks, livelihoods and self-reliance, and also questions around information sharing and feedback mechanisms. This helps us to better plan a broader information sharing campaign and also to set up an appropriate appeals mechanism. Next slide, please. So the consultations also help us to mitigate potential risks of the targeting or prioritization exercise. Here we have 3 examples. This is certainly not a comprehensive list, but the first example is a potential risk that we exclude highly vulnerable refugee groups from targeted assistance. And the community consultations help us to partly mitigate this risk since we discussed the proposed eligibility criteria together with the refugees. We try to make sure that the most vulnerable are included in the eligibility criteria, and we adapt the criteria based on refugees' feedback. Then the second potential risk is a possible resistance from refugees against the plan changes. Again, the consultation should help to increase community ownership of and buy-in in the targeting or prioritization process. And since we share information, key messages throughout the process and during the consultations, this should help to make sure that everyone is well informed, understands which changes are happening and why they're happening. And this should also help with the third point, the potential risk of rumors spreading. Next slide, please. So here's some key considerations for planning community consultations. So this is a qualitative exercise. We should think about carrying out focus group discussions and key informant interviews with refugees and host communities. Again, host communities, it's not a must, of course, to involve host communities, but it would be our recommendation also to check some of the potential protection risks and how the exercise might affect relationships between the host communities and the refugees, etc. Again, the tools, we have templates that you can find on the website to carry out these consultations. Then regarding for the consultations with refugees, we should make sure that we have a diverse group of participants, right? So you may want to include refugee committee members, representatives of women's groups, organizations for people with disabilities, youth groups, possibly teachers and health workers, religious leaders. The important thing is here, of course, to adapt this to the specific context, right? This is just a few ideas, but field staff will know best who to involve for this. The important thing here is to not only limit the consultations to refugee leaders and to go beyond the leaders and make sure that we include other refugee voices in the process and that we also include the most vulnerable in these discussions. Then separate focus group discussions should be carried out for women and men at the minimum. And beyond that, you might want to have more different separate groups for discussions. Maybe there are child-headed households, etc. And you want to have consultations with a group of minors. So this is really up to, of course, you to decide. Then we have a few last points. The consultation sites should be decided in close collaboration with the field officers who know the specific context best. If you have a limited number of camps, then maybe you should probably carry out consultations in all these camps. If you have a large number of refugees spread over a large area, then you will have to select certain sites to carry out the consultations. Also taking into account staff capacity at the time that you have for the consultations, etc. And of course, COVID-19 related restrictions have to be taken into account along the process. Very briefly, a few last points. Communication should be inclusive. The consultation should take place in the language that the refugees speak. Visual materials can be used to present the draft eligibility criteria to the participants, especially where there's a limited literacy. And then we recommend developing a joint action plan with the different steps, timeline, and responsibilities, so that everyone involved knows which steps have to be taken, by when, and by